in order to make a program work, it requires proper commitment. So it's all very well piloting something just to make sure that the mechanics work, but you're never going to get the results that you want with small level programs, because you just don't have enough support from the wider service to make those happen. And because they're small, nobody really takes the results very seriously. So I think that where we've seen our best impact is where you take, let's say for remote monitoring, if you take 10,000 patients and push them through it, then the statistics that come out are totally compelling. If you take 500 patients and push them through a program, it's much more difficult to see the impact that that has. And because they're smaller programs, you get less support from the wider health service, and because you don't get that support, you haven't got the buy-in from lots of the key decision makers that are there, and it can take a year or 2 years or 5 years before anybody moves the program along. We've seen that a lot, actually. So we've often brought in new technologies into the health service. So for example, we put shared care records into one ICS. It was about 20 years ago, and it took years and years and years before the health service as a whole caught up with the idea that a shared care record was a good idea. And 20 years later, every ICS has got a shared care record, but for the first 10 years, there was only one ICS with a shared care record. So you can see that it takes quite a long time to take a pilot into full-scale production.